Thursday night, 9 Eastern. But first, let's take a look at where the debate stands right now. And joining me to discuss this is the author of What Americans Really Want. Really, Frank Luntz is with us. Frank, welcome back. Thanks. Well, you're out there in Vegas. Are you gambling? You're a pollster.
I'm a pollster. I know better. The odds aren't good for people, so I watch others gamble.
All right. Well, I like to.
And by the way,
yeah.
There should be no gambling on this health care bill. I'm going to do a nice little segue here. The American people would not bet on it. They would not bet that it would be deficit neutral. They will not bet what Obama's saying, that it'll increase their quality, and they certainly would not bet that it'll give them more control.
Listen, one of the reasons we're staying on this is now the key month, the key weeks in this debate, because we got the Baucus bill. You see how antsy the Democrats are. They're threatening retribution against the insurance companies for pointing out this is going to cost the American people a lot of money. You have done some surveys. One of the big questions you were asking, who do you trust to decide on health care? And you found?
We found that doctors beat politicians by about 7-1, and that family doctors beat everybody else. We've spent some time listening to doctors and medical professionals. They tell us two things. Number one is, if they're cutting our reimbursements, that means that it's going to be cutting our ability to treat patients. And number two, if doctors are basically handcuffed, then who's going to provide the medical care? We spend so much time listening to senators and congressmen in Washington, Sean, that know nothing about health care, when the medical profession is begging, listen to us. And I'm going to say something that's controversial. The American Medical Association does not represent so many doctors out there that are frustrated with what's going on in Washington and are afraid that because of this reimbursement, because of these cuts, they won't be able to do the medical care that they know they need to provide to people.
I'll one-up you, because I agree with that statement, and I know a lot of doctors, and I've talked to a lot of doctors. There's not one that I know that supports this bill, except for the people that were handed out white coats at the White House in a photo opportunity. But I will tell you, the AARP is not serving the elderly in this country because they've got a political agenda. One of the big questions, Frank, has been the Senate Finance Committee had an opportunity to vote on an issue that they put this bill online for 72 hours. There's an Oregon he has a discharge petition right now, and he's trying to get enough people to support it where the bill would be put online 72 hours. Why are the Democrats resisting that? You have some data to back it up.
Yes, we found that an even higher priority, if you guys can pull up the approach that you want government to adopt, is chart number 3. The American people, even more than demanding that Washington read the legislation, the American people want to read the legislation themselves. Now, here's the challenge. It's a 1,000-page bill, or in this case, it may be a 1,400-page bill. I don't think 72 hours is enough. But the public would say, if you deny us that opportunity to know what's in this legislation, then we're going to deny you our support. And it's one of the reasons why support has been dropping. And I give that Oregon congressman a lot of credit. Oregon's having this huge fight right now with the medical community, and it's one of the places where doctors are saying, listen to us. The politicians don't necessarily get it right. Listen to us. We're the deliverers of health care. We care about our patients. We care about what happens in the medical community.
Yeah.
Pay attention.
You know, and Frank, I'm not saying that there's not a need for reform. I'd love to see tort reform. I'd love to see those without insurance get the tax credit so that they can get in the system and get a policy. Portability issues, medical savings accounts, none of these issues that conservative supports, they weren't even allowed to bring these to the table. When you ask the question, define the state of health care in America, most people agree with us that there is a problem, but they don't necessarily believe the government option is the answer.
They do believe that the healthcare system is, and I quote, seriously troubled. That's where the majority of Americans. But there are less people today that believe it's a crisis or seriously troubled than there were 6 months ago. And the reason for that is that more people are starting to feel like this healthcare reform will actually make the system worse rather than make it better. And by the way, I'm always telling people who talk about tort reform, it really should be lawsuit abuse reform. Too many Americans think torts are a French pastry.
Yeah, all right, there you go. Well, it actually would be a tart, although I don't want to eat many French pastries, Frank. All right, one of the things that you did ask that I really found intriguing was the idea that if in fact, and I think this is for Blue Dog Democrats in particular to pay close attention to, you ask the question of people, if your representative, if they vote for the government option, you will, and this is the results I find fascinating, about 50% want them out of office.
And you've got 1 out of 4 Americans that would actually work for them to be removed from office. All the intensity in the health care reform debate is among those who are saying that this legislation is being pushed too fast, it costs too much, takes away too much control, doesn't provide quality, and doesn't protect the patients that it is meant to. And the American people are saying, and this is the biggest warning that can be provided, particularly to conservative Democrats and moderate Democrats, if you vote for this, you're going to have a problem 1 year from today.
All right, Frank Luntz, interesting data. We'll continue to follow it. These are the important weeks. Appreciate you being with us.
Thank you.